In this video, I answer a question on why a rib popping out of place causes so much mid-back pain and why getting a chiropractic adjustment isn't helping the pain anymore. For those of you who don't know me, my name is Dr. Maggio, and I am a chronic pain treatment expert with over 15 years of experience, specifically for neck, upper back, shoulder, and arm pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in overall functioning, flexibility, and long lasting pain relief. All right, this week's question, it looks like it came from Chris on Instagram. Let me read it. For the past year or so, it seems like at least once per month, I seem to pop a rib out in my mid back, and the pain is pretty intense and stabbing when it happens. I seem to wake up with the pain as well. For the most part, I have been able to get to the chiropractor and get it adjusted and put back in place, which helps the pain mostly go away. The past two times it happened, the adjustment didn't do much for the pain, and it took a whole week for it to get better. Why does my rib keep going out? And why isn't the adjustment holding anymore? Thanks so much for sending that question in, Chris. And just a quick reminder, if you have any questions you want me to cover specifically on chronic neck, shoulder, upper back, elbow, arm, or wrist pain, send them my way. And if I think my answer can help, I'll get a video out to you for that. And all the information to request or send in that question is in the description box below or wherever you might be consuming this video. So let's get right into it. So, first things first, when this is happening and you're getting this type of pain, you're actually getting what's called a sclerotome pain referral pattern, as you can see here in the photo. It's actually not the rib going out of place. If it was the rib, you'd be in some really, really serious and horrible pain. And that's like a medical emergency. More than likely, this is a referral pain from what is called the sclerotomes. And you can see here on the chart, it really likes to kind of go on a very predictable pattern. I get it why people think that it's more of a rib problem because it is sharp, it is stabbing. The breathing can become difficult as well. That's why people a lot of times think that it ends up being a rib out of place, but it really isn't. But they tell you that, they do the adjustment, it does feel better. But as Chris was saying in this question, adjustment just isn't getting it anymore. So, what really happened? So, the first thing is when I'm assessing a client or a patient, I'm always asking questions. And one of my questions is like, is there a history of like a direct accident or injury to the area? And a lot of times when there isn't, I'm thinking that this is like a compensation pattern. So the first thing that develops is this stuff called adhesion. I talk about it all the time. It's like a glue that gets inside the muscle, also refer to it as scar tissue. And basically what happens is with bad postures, stress, lack of movement, maybe doing too much stuff, the muscles really start to get overworked and they don't get enough blood flow and oxygen, and then they send a signal to the brain, and the brain's like, hey, what's going on? Must be an injury there. So it starts to pump out what's called collagen fibers, but they're not like fully cooked collagen fibers. They're kind of like immature, and it sends it out to go inside the muscle. It gets inside the muscle, and the first thing it does is makes the area less flexible, and then it makes it weak, and then blood flow can't get in, and then the bad stuff can't get out, and it creates a lot of inflammation. The adhesion itself is bad enough, but it's usually not high enough where it will alert you on a pain level. It kind of just feels a little tight or achy, but nothing where you'd want to like make an appointment to go see a doctor or get a massage or get like some type of adjustment. Then what happens over time is as that adhesion gets bigger and bigger, eventually what it does is it gets stuck to all the nerves. And when it gets stuck to the nerve, it causes more problems. It can cause some numbness and some aching and some burning and some tension. So nerves are kind of built with like extra slack, like a rubber band. It has about 15% of extra slack to make its way through the body and get where it needs to go. But then that adhesion gets stuck in there. And when the nerve gets stuck, everything kind of tightens up a little bit more. The body engages in what's called like a protective tension because it wants to unload that area and take the pressure off of there. So sometimes you might see like your trap up or your shoulder rolled forward, all sorts of things because the body's trying to protect that nerve entrapment. So now you got the adhesion, now you got the nerve entrapment. Then what happens is, as I said, you don't get enough force into the area. The area is like weaker and less flexible. Then what happens is the force has to go somewhere, and where it ends up going is into the discs and the joints in the neck. And the discs and the joints in the neck are really just designed as like good shock absorbers. But over time, when it doesn't have the muscles to support it, the nerves are inflamed, more force goes there, and the disc starts to slide and grind on itself. And when this happens, then it puts pressure on the disc. And this is where all that sclerotome comes from. And a lot of times when you're getting like that deep mid back pain into what feels like the rib out, it's because those joints in the neck are getting really inflamed. And they do tend to be a little bit worse when you're sleeping, because when you're sleeping, gravity isn't acting on you as much. So it puts more pressure in there. Then what happens is you wake up, you feel like crap, and you're like, what the hell happened? It's because that disc is really inflamed. So why did the adjustment help at first, but it isn't working anymore? So one thing that happens when you get an adjustment, so there's this fancy and very detailed track in your spinal cord. It's called the lateral spinal thalamic tract. I'm going to call it LSTT for short. So basically what happens is it works up your spinal cord, and two things travel up there. The first thing that travels up there is just vibration and movement, and the next is pain. So when you get an adjustment, what it does is it kind of stimulates all those vibration and movement things, and then it kind of blocks the pain a little bit. It's kind of like your thumb gets jammed in the door, you kind of shake it out. And what was happening with Chris was that disc wasn't as inflamed yet. So getting the adjustment kind of brought him below what's called symptom threshold. And what it was really doing was it was helping with the effect, but not the true cause of the problem. This is why the adjustment isn't working anymore. So, what to do when this does happen? I get it. You wake up, you can't turn your head, you're having trouble breathing, you're like, oh my God, am I having a heart attack or something really bad going on? A lot of times it's just things are getting beat up and getting overused. So, the first thing you want to do is when it does get bad, just let it chill out for a few days. Don't like try to make like an emergency appointment with the massage therapist or get in with the chiropractor because you're in a lot of pain. That's the body's way of saying, hey, you did a little too much over the last couple of days. I want you just to kind of chill out. A lot of times when these discs are really inflamed, they take a couple of days to chill out. And a lot of times when you do get treatment, you kind of start that clock all over again. And then you're having more and more issues in there as you go. Next thing is, if it continues to happen, you're not getting any better, get it properly evaluated for adhesions, nerve entrapments, and inflammation. That's exactly what I do, what the providers that are trained in my system do, called the peak method. We're experts at finding and fixing adhesion and reducing inflammation. Then get it treated by an expert that's going to be able to go in there, find where those nerve entrapments are, get where that adhesion is, and get it done perfectly right and get it out there for good. Then just be aware of lousy postures and positions. If you're like a bent over shrimp all day long on your phone, staring at the computer all day, get up and move, walk around, be a real human. Once you get the adhesion cleaned up, you're doing better things with the posture. Then you can start to build up some strength in the neck, in the mid back. That really helps to keep this from coming back, because when you have a lot of the adhesion, like I talked about, first it's just less flexible, but then it becomes weaker. But if you try to strengthen the neck and the mid back before you clean up all the adhesion, get the pressure out of there, you're still doing the same bad postures and all that. It's going to be kind of counterproductive and not get you better. So that's all I got in the video. If you need help, we're here to help. Have providers trained all over the world in our system called the Peak Method. And what they do offer is a no charge injury consultation for anyone that's been dealing with a problem for at least 6 months. They've seen multiple people and they're not getting any better. All the information to request that consultation is in the description box below or wherever you might be consuming this video. I appreciate you watching, and I'll see you on the next one. Bye.